Welcome back to Pebbles series, differentiating the difficulties with me, Kavya Tendral. Today, we'll be seeing important topic from forensic medicine and pathology. If you have not subscribed our channel, do subscribe for more interesting videos like this, and as well press the bell icon so that you will receive a daily video notification. The prime objective of the video is to remember the concept and retry using easy ideas and tricks at the critical time of demand, especially at orals or when we are solving some MCQs. We will be seeing about the prostaglandin effect on platelet action from pathology and medical jurisprudence from forensic medicine, especially the criminal responsibilities, the Indian penal codes. First, we will be seeing the prostaglandin effect on platelet. It is divided into two. One is pro-aggregatory prostaglandin and another is an anti-aggregatory prostaglandin. Pro-aggregatory prostaglandin will ultimately cause aggregation of the platelets. And when the platelet are aggregated, the clotting factor, the cascade will be activated. That is extrinsic and intrinsic pathways. For that, it needs 13 different types of clotting factors. To remember this pro-aggregatory, let us stick on to this 12th factor. 12th factor is basically Hageman factor. So remember the name Hage. Having that in mind, if we see it, it is prostaglandin H2, thromboxane A2, PGG2 and PGE2. There comes Hage. So it is pro-aggregatory prostaglandin. Coming to anti-aggregatory prostaglandin will not cause aggregation. So what is going to happen is when in any situation when an officer is not allowing you to that one restricted place, you will be showing your ID card for your for allowing you, and therefore the mnemonic here is also ID. What is that? It is I2 and D2, PGI2 and PGD2 are anti-aggregatory prostaglandin. Now coming to criminal responsibilities in medical jurisprudence. To remember the number, IPC number, it starts with 8. How to remember that 8 is criminal? If you start counting the letters in this word, it is 8 letters. So the IPC will be starting from 82 to 86. It is 2-digit number and starting with 82. Here 82 and 83 in this group are the smallest, and therefore the criminal law is related to children. This is related to 82 and 83 for children. Now coming here, 82 and 83 are same related to children, but 82 is less than 7 years of age, 83 is 7 to 12 years of age. But remember, this 7 to 12 years of age, the children should have impaired mental development or mentally challenged. These children are not liable to the act. This is all about 82 and 83 IPCs. Next is 84, that is McNaughton's rule. We are more familiar with this. Knot, McNaught. So we remember knot, right? So a knot is something like this, and in this knot, when we see this knot, it is twisted like this and it gives a configuration of 8, and there are 4 ropes are going here there. So let us remember 4. If at all 84 is difficult to remember, so McNaughton's rule is IPC 84, and it is all about the act of person of unsound mind. It is very important that it states nothing is an offense which is done by a person who at the time of doing it by reason of unsoundness of mind is incapable of knowing that the nature of the act, or that he is doing what is either wrong or contrary to law. Ultimately, if a person is unsound of mind when he is doing the offense, he is not liable for that offense, and therefore this is all about McNaughton's rule. Next is IPC 85 and 86. One important thing to remember is 85, 86 are related to intoxication. When we compare 85, 86, 85 is the odd number by max. So the law is also similar to that. When a person is involuntarily intoxicated and he is doing an offense, at that time he is not liable to the act. This is 85. Doesn't it look odd? The person is intoxicated. The reason he is involuntarily intoxicated, he is not liable to the act. Next, coming to 86. Here the person is voluntarily intoxicated and he is committing offense, and now here he is liable to the act. This is all about IPC 86. 85 and 86 are related to intoxication. 85 is involuntary intoxicated, that is, it looks like all right, just to remember. Thank you so much for your patient listening.